Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through July 22nd, 2021. This week, I'm simply going to ask one question, and that is, are we seeing a resurgence in cases, hospitalizations, and deaths from COVID-19 due, we assume, to the Delta variant? Well, globally, we're seeing continued growth. 1.7% increase in the past week. That is, in fact, the largest increase in the past 4 weeks. Whether that's a significant difference from 1.3, 1.4, 1.7, we'll have to wait and see. But almost 70,000 deaths worldwide in the past week. That's 6.5 deaths every minute. But what I want to pay attention to a little bit, this is the number of daily cases. So you can see back in March and April, there was this general rise worldwide. And we've seen 2 spikes, and now we're seeing clearly a third spike. Now, how high it's going to get, how wide it's going to be, we don't know. So that's cases. As I've mentioned many, many times, I'm not a great fan of cases because it depends on how much testing you do. So I prefer to look at deaths. And so far, we're not seeing a comparable increase in deaths. So it's pretty clear for the last couple of weeks, there's been a slow, steady rise. In terms of daily cases in the US, after quite a significant drop from December, January, there was a little bit of a spike. Then we were seeing a clear drop in cases. But again, just as with the world, we're seeing an increase in cases. Now, again, cases are dependent on testing. So historically, the 2 things we've looked at are hospitalizations and deaths. And hospitalizations are clearly also starting to come up. The same kind of pattern you saw. So if you look back, you see the cases go up, a little bit of hump there, back down and come back up again. And now we're seeing the same thing with hospitalizations. And that's quite worrisome because hospitalizations suggest that there are serious people, serious cases, people getting quite ill. Now, we've not yet seen the increase in deaths. And again, you see this slow decrease. Don't conclude from that necessarily the Delta variant is less lethal than the previous variants. It may well be that it's affecting different populations that, while they're likely to get sick, may not get as sick. But the fact that we see increase in hospitalizations does worry me because, hospitalizations follow cases and deaths follow hospitalizations. So we'll keep our eye on that for sure. In terms of the US, 625,000 deaths so far. Last week, 0.3% week-to-week increase. This is about the 6th week in a row that we've had less than 0.5% week-to-week increase. That's good, but still saw almost 1,800 deaths last week. That's 250 deaths a day and about 10.5 deaths every hour. And I only stress that because we've got to stop this idea that as things are slowing down, we're out of the woods and we can revert back to normal. Now, there's been a lot of talk this week about the Delta variant. It now represents about 80% of the sequenced cases in the US. So it's gone, just as we've been talking about it, from 10 to 40 to 50, now 80% of cases. There is some good news that came out this week, and that it is reported in the New England Journal of Medicine that it appears that the vaccine is effective against the Delta variant, at least after 2 doses, perhaps less effective after only 1 dose. But the good news here is if we are vaccinated, we appear to be protected from serious disease associated with the Delta variant. Unfortunately, only 56% of Americans, 44% of Tennesseans have had 1 dose, and less than half of Americans and less than 40% of Tennesseans are fully vaccinated. And this is especially problematic in young people, those under 18 and those 18 to 24, where you can see 11 to 43% or so. These are largely the groups that are becoming back to colleges and universities in the country. So we certainly need to encourage vaccinations in those groups. And some are now referring to the current spike in cases as the pandemic of the unvaccinated. The question of mask mandates remains divided. The CDC is continuing to say that if you are fully vaccinated, you can return to your pre-COVID activities. But this week, the American Academy of Pediatrics came out and suggested that all students, teachers, and staff wear masks while indoors in schools, whether they are vaccinated or not. So I suspect what we're going to see is over the next couple of weeks, if the number of cases, hospitalizations, and potentially deaths start to go back up, we will certainly see more dialogue about the importance of masking. Until then, you've got different recommendations from the CDC and the American Academy of Pediatrics. So a lot is changing, as it has been throughout the pandemic. The good news is that we're not seeing a spike in deaths. The bad news is we are seeing a spike in hospitalizations and a spike in cases. We'll keep our fingers crossed, keep our eye on the statistics, and I'll keep you posted. As always, there's a great deal more information about COVID-19 on the College of Public Health website. If you are sharing this video with others, please let Jan Stork know. We're happy to add anyone to our mailing list. And thanks to Dara Young for editing, producing, and posting this video. And as always, if you have any questions about the Delta variant, about the vaccine in general, I'll do my best to answer them for you. Until next week, please be well. Thank you very much.